I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute. One of the most common things we see in our practice is Achilles tendonitis. Achilles tendonitis is essentially inflammation of the Achilles tendon, which comes on the back of your heel. It attaches right here. And oftentimes it hurts right there or up about 3 inches from the heel in this area we call the watershed area. Now, this pain is very bad for some people, and some people it's not quite so bad, but it does bother people nonetheless. And if untreated, it can become problematic, whereas the tendon may rupture and break, and that requires casting for a prolonged period of time or possible surgical intervention, so we try to avoid those things if we can. And one of the most common ways to treat this is to take the pressure off the Achilles tendon so it can heal. Like with anything, you have to let it rest. Unfortunately, sometimes you want to keep walking and you can't really let it rest that much. So the way we do that is to use a lift in the heel. And this is just a felt lift, and it goes inside the shoe. And you have to do both sides, even though both sides may not be hurting you because you don't want to be crooked. So you put this in the shoe, and it lifts up the Achilles tendon by about 1/4 inch. And that takes the pressure off, and that allows things to heal. In addition to that, we can utilize air heel. And this is a device that has a little air pocket in the back and on the bottom of the foot. And so when you walk, the air circulates from the bottom to the back, and that causes pressure and it increases the circulation in this area, which allows the tendon to heal faster. Now, we use this during the daytime, and then at nighttime, you want to allow this tendon to heal by letting it rest in the right position. So we use a night splint. And the splint goes on the foot and it holds the foot back like this. And that stretches out the Achilles tendon back here. So all night long when you're healing, when you sleep, the Achilles tendon is healing in the right position at the right length. Because if you didn't have this on, it would be down and the tendon would be contracted and it would be healing in the contracted state. And then you stand up in the morning and you rip all that apart, all that healing apart, and you're back to where you started, so you're not getting ahead. But this allows you to heal and get ahead. So the next day, all the healing is already done and you're in that lengthened position already. Then eventually, what we do is put you into a device called an orthotic. And we incorporate the orthotic as a mold from your foot, but we incorporate a lift. So we kind of put a lift already in the orthotic down here, and that lifts up your heel just a little bit, and that prevents this from coming back. So this is a long-term fix, and you can just wear orthotics the rest of your life or just for 3 to 6 months while this calms down. The orthotic goes inside your shoe and no one even knows you have it on. It actually helps your foot feel better, and it brings the ground up to the foot. So these are all non-invasive ways to treat this condition. So there's no drugs, there's no side effects, there's nothing bad. It's just all natural, and it's your own body healing yourself. So bottom line, with Achilles tendinopathy or tendonitis, you just have to take the heel and lift it a little bit and let the body do the rest. If you do this for 3 to 6 months, maybe only 6 weeks, the pain usually goes away.